And go.
Good morning, everyone. This is the November 15th. We are with Health and Human Services Committee. I'm joined, as always, by my colleagues, Council Members Rice and Glass. And as all three of us have discussed, one of our favorite days of the year is this and the second day, when we get to hear the report outs and recommendations from our boards and commissions. What I've noticed over the last several years of having had the opportunity to participate in these is it really gives you the appreciation of how connected all of these issues are on so many different levels, that one directly impacts the other and vice versa. I'm also struck by the remarkable, and I mean truly remarkable, dedication and commitment that we have of board and commission members here in Montgomery County. We have some of the smartest people in the country right here in our community working hard to advocate for the issues that they know so well and the communities that they care so much about. And so this morning, as we've done the last several years, we will have the opportunity to hear from our boards and commissions. And the way we will structure this is we are going to have three presentations. And so what we'll do is in the first group, we're first going to hear from Ms. Jackie Williams from the African American Health Program. We will then hear from Ms. Laura Mitchell from the Alcohol and Other Drug Abuse Advisory Council, and then from Dr. Nguyen from the Asian American Health Initiative. After all three presentations are complete, and each one will last approximately 3 minutes, but if you go a little over, that's perfectly fine. We'll pause and my colleagues and I will ask questions of those three groups. Once we complete that Q&A, we will then move on to the next group of three. And so we ask that you leave your camera off unless you are the speaker, but be ready to turn it on when it is your turn next. So again, in the first grouping, we're going to be hearing from our African American Health Program, the Alcohol and Other Drug Abuse Advisory Council, and our Asian American Health Initiative. So would my colleagues like to say anything before we get started this morning?
Good morning. I'll just say I welcome this conversation, and Mr. Vice President, you were absolutely correct in saying that these are our two favorite days at the committee, where we get to hear from all the people who are making our health and human services sector and department and agencies and nonprofits work to keep us all healthy and safe. So I look forward to the conversations.
Thank you, Councilmember Glass. Councilmember Rice, did you want to say a few things? Oh, I think we're okay. And Council President Hucker has joined us this morning. He would like to hear specifically about our African American Health Program and respond to questions there. But I don't know if you heard, Mr. Council President, we're going to hear from the first three groups. Each presentation is approximately 3 minutes. We will then pause and ask Q&A after that. And Councilmember Rice has joined us as well.
Perfect, thanks. Sorry, I'm rushing kids to school, but really interested in the discussion. Hope everybody had a good weekend. Thank you, Mr. Chairman.
Absolutely. You as well. Councilmember Rice.
Well, thank you very much, Mr. Vice President and Chair. And let me just say again that your words couldn't be more apropos for today, and understanding that what's gotten us through the pandemic is all the people that we're going to be hearing from, who have continued to make sure that they're working in the community in their various roles to stand up government, and to more importantly, stand up our community and their neighbors and the individuals that they normally help each and every day. And if it weren't for the infrastructure that each of you as volunteers and some paid staff have put together, we wouldn't have gotten through this pandemic like we did. We wouldn't have saved lives like we did if it were not for your great work. And so we're anxious to hear from you about the great thoughts that you have about how to continue with COVID recovery and how we can continue to lift folks up. And look forward to working hand in hand with you and continuing to support you in your efforts, because we know that you're doing yeoman's work. So with that, I turn it back to you, sir.
Thank you so much, Councilmember Rice. Ms. Yao, did I miss anything? Was there anything else that you wanted to tee up before we get started?
No, you got it all. Thanks.
Thank you. And thank you for coordinating this. I know this is a favorite day of yours as well. All right, so we are going to start with our African American Health Program, and I'd like to welcome Ms. Jackie Williams. Ms. Williams, thank you so much for your and your team's continued dedication. We've had many, many conversations over the last year and a half And we just so appreciate your and your team's leadership in so many ways. The floor is now yours.
Well,
and if you can turn your video on, somebody allows you to do that, that'd be great.
Well, you're not going to see me anyway.
Okay, no problem.
One day I'll do it.
Okay, not a problem.
Okay, thank you, everyone. I just appreciate the opportunity to speak to you about our priorities. And first, I just want to read my prepared statement first. Dr. Martin Luther King Jr. stated, "Of all the forms of inequity, injustice in health is the most shocking and inhumane." The HP priorities for 2022 will center on the elimination of health disparities in health care for the Black population of Montgomery County, Maryland. Although Montgomery County residents overall surpass the state in good health, there are significant pockets of poor health outcomes among the Black population. Specifically, the AHP is dedicated to increasing the number of COVID-19 vaccinations, reducing the high infant mortality rates, and reduce poor chronic disease outcomes among the Black population of Montgomery County. With regard to COVID-19 vaccine hesitancy is having a profound effect on the death rate for the Black population of Montgomery County. The evidence for this differential impact includes long-term existing chronic health, that is pre-existing conditions, and social disparities. Understanding the vestiges of historic racial bias that have not disappeared and how poor health access and treatment, distrust in the healthcare system, and pervasive disparaging behaviors showing lack of respect and belittling portrayals of the Black population have sowed the seed for their lack of receptiveness for the COVID vaccine. AHP is not surprised that the top COVID codes mirror AHP's geographic hotspots. Priority for the COVID vaccines should be in the geographic hotspots East County, Gaithersburg, Lower Silver Spring, where the largest concentration of Black population reside, and where there is a disproportionate rate of coronavirus infection and deaths of the Black population. It is important to educate Black population about the increased risk for the coronavirus and to immediately dispel any misinformation within the communities that Black populations have protected from this disease. Stem complacency and COVID fatigue by enumerating ways to stay safe and avoid the disease, encouraging individuals to take steps if they might be sick, such as having an increased temperature, trouble breathing, etc. Infant mortality, you see I'm going pretty fast, trying to, increased to, according to Health in Montgomery data as of 2018, there is a steep rise in infant mortality of cases among Black women compared to all other races and ethnicities in the county. The HP Start More Infants Living Healthy, that is the SMILE program, which is a case management model, was developed to address infant mortality utilizing evidence-based strategies. For 2020, the AHP has seen an increase in homeless pregnant women and domestic violence, which involves more complex interventions. Much has been done to close the gap as it relates to Black infant maternal mortality. Utilization of standardized protocols to treat and identify complications experienced by pregnant Black women should be implemented. Identification and removal of racial bias in the treatment of Black women will aid in closing the disparity. With regard to chronic health conditions, the differential impact on health disparities includes long-term existing chronic health and social disparities, higher rates of underlying health conditions in the African American and Black community, that is hypertension, chronic lung disease, asthma, diabetes, kidney disease, and others. Socioeconomic factors, that is decreased access to healthcare, poverty issues, and other multiple negative social determinants of health. It is noted that the Black population in Montgomery County seek treatment for and have significantly higher rate of emergency visits for diabetes than any other race ethnicity in the county. The HP Chronic Disease Program has shown great progress in reversing pre-diabetic clients using a wraparound services and plan to expand services to continue to combat this problem. I want to also circle back with this. Do I have time?
Yeah, how about 1 or 2 more minutes, and
Okay.
we'll come back to Q&A afterwards. Already 2 of my colleagues have put in requests to ask questions, which we will ask immediately after the other 2 presentations.
Well, maybe I should wait for the Q&As.
Okay, that sounds great.
Okay.
Thank you so much, Ms. Williams.
Alrighty.
Next, we will hear from Ms. Laura Mitchell from the Alcohol and Other Drug Abuse Advisory Council. Ms. Mitchell.
Good morning. I too am on the road, so I can appreciate the multitasking. Thank you for having us this morning and for taking such good care of our community and looking at all of these, the various issues that our BCCs address. With the Alcohol and Other Drug Abuse Advisory Council, I pause on that word, you'll hear why in a moment. We have spent the summer looking at our priorities and what our needs are in this community and what we can do to fill them, where those gaps are and how we can fill them. One of the biggest things that we came up with and our top priority for a committee as a whole is the need for adolescent mental health, but mostly substance use treatment and recovery. We just don't have those services here. It's particularly complicated when you have a child who is LGBTQ or has other special needs and has a substance use issue, which is quite common intersection. So we really want to, much like we did with the Avery Road system, look at what we need in this community to be able to serve our youth in the same way that we're serving our adults with that wonderful facility. Another issue that we have identified for the prevention committee, we broke it up by our subcommittees. One is to try to get naloxone, Narcan, the overdose reversal drug, on all of our transit buses and with our drivers. We've had a couple of instances where people have lost their lives either at bus stations or near bus transit operations. And we think that's an important thing to have. If someone is on a bus route, not near help, it could mean the difference between life and death if that driver is carrying naloxone and is able to administer that while they wait for emergency services. So we think that's really huge. The other one for the prevention committee, another one is the working with Ben Stevenson and his group to stand up an alliance, the Prevention Alliance's Youth Ambassador Program, an MCPS. We want to get our students involved early and often so that they can have their voice with their peers. They listen a lot more to peers than they do to us as adults. And we think it's important to involve them in the process and in the prevention efforts that we're doing and promoting substance use screening by physicians for teens at their regular appointments. They're doing health questionnaires. We would like to see them look at their mental health and their potential substance use at the same time. One of the big ones that prevention is really working hard on, and we know that there's a charter review underway right now, that's changing the language that we use around addiction and substance use, getting stigmatizing words out of our vocabulary, out of our charter and our committee names. Our name has abuse in it, and that is often a stigmatizing word that keeps people from seeking and getting treatment. And it also hinders public perception in that when they do get to recovery, people have this negative connotation and often won't give them a chance. So I think that is a major step that we can take very easily. Interestingly enough, the document that we're using as our guidance is Words Matter from NIDA, who also has abuse in their name, but that is something that the federal government is also addressing. The Recovery Committee would like to work with the Chamber of Commerce and other businesses to make sure that their staff and managers have naloxone on hand, particularly in businesses, fast food, gas stations, things like that, where someone may often go to seek shelter to use, and overdose may be found in those situations. So we would really like to focus on that harm reduction strategy, as well as getting the fentanyl strips that can test to see if there is fentanyl in their drugs for those that are using an active addiction, that they can tell before they use that they need to be more cautious. Obviously, we would prefer that they didn't, and we want to do everything that we can to help them into recovery. But if they are in active addiction and they are using, there are ways that we can help them to not overdose and to not die. And that's really, really important for us. Peer recovery support specialists for the families. We're doing that with people in early recovery, people who have experienced an overdose, who are in the hospital. We connect them with peers, but we're often not supporting the families. We feel like we could have a lot more success if the family gets more education and more involved in that recovery process and what that looks like, and even in the support process until they're ready for recovery. The legislative committee, we are looking to help enforce parity and equity, working with outside groups on their efforts to get rid of those roadblocks to getting treatment, and to make sure that we can have the insurance coverage that we're all paying for in order to get adequate substance use treatment when it's needed.
Perfect.
Okay. Sorry, go ahead.
No, that was really, that was a very compelling testimony, Ms. Mitchell. I definitely have some questions I'll follow up on after the next presentation. But thank you so much. That was chock full of really, really helpful information and great recommendations. I also see in the audience, we've been joined by Dr. Kroll, our Director of Health and Human Services, who has shared with me he looks forward to these sessions as well in order to hear holistically from our respective committees. I'd like to give him an opportunity to say a few words now, if you'd like, Dr. Kroll.
Good morning. Thank you, Council Vice President Alvarez and Council Chair, Committee Chair. I'm happy to be with you all this morning as usual. It's and my apologies for being late. I had some trouble getting the link to join you this morning, but here I am nonetheless. This is one of those moments when I get a chance to hear from all of our boards and commissions in one place, in one setting, to understand and gain wisdom and information from knowledge from you all about what your priorities are, how you see the world shaping up for the department and for the community that we serve. I very much appreciate all of the work you all have done to keep going and keep meeting and keep doing the work in the midst of the pandemic and over the last year. It seems to me that Zoom and Teams have actually helped that process in many respects, but it has not been easy. So we appreciate the continued support for the department. I'm not going to belabor this because I know there's a lot of testimony we need to get through. So I want to turn it back over to you, Council Vice President. And thank you all again.
Thank you so much, Dr. Kroll. Next, we will hear from Dr. Nguyen from our Asian American Health Initiative, who will give a presentation. After Dr. Nguyen finishes his presentation, we will then ask Q&A of the first three groups. And Dr. Kroll, if you have a question that you'd like to ask, please feel free to text me as well. We're happy to join you in this conversation. Dr. Nguyen.
Yes. Thank you very much, Council Vice President Albanos, and good morning, the Council Health and Human Services Committees, Council President Tucker, and Dr. Kroll. My name is Nguyen, and I'm served as the chairperson of the Asian American Health Initiative Steering Committees. Thank you for the invitation. I'm Anand, and I am honored to be here to share with you the AHI priority for the fiscal year 2022. So AHI will focus on three priorities in this fiscal year. Number one is the COVID-19 relief effort. Number two is the continuation of the mental health and senior wellness programs. And number three is to improve our data collection to reflect the dynamic and the need of the Asian American community. So first of all, the Asian American community has been significantly impacted by the COVID-19 pandemic, and the ongoing relief effort is needed. As you're aware, the impact of the COVID-19 has been on all minority communities, and Asian American are not an exception. So in our county, 30% of Asian Americans have limited language English proficiency, and 70% of Asian American in the Montgomery County is immigrant. So the fact that the English the limited English proficiency and immigrant status is always the health barrier to the Asian American community to access to healthcare. And that become more challenging in the time of the pandemic. So I just want to thank you, the HHS committee, Councilmember Avanos, Councilmember Class, Councilmember Rice, for your support of the COVID relief grant, and also our council for all the support for the COVID relief to the Asian American Health Initiative for $1.4 million in this fiscal year. And in this funding, $1 million go directly to support the NGOs to provide services to the Asian American community. That has turned into grant, and AHI have been working to deliver this mechanism. We released, and the Asian American community has been greatly welcomed this support. Is much needed during this time. And we have been released the RFP. We received the flooded number of application because the needs are high. With them over 33 application that we received, 15 was deemed highly eligible, and the total amount requested was almost $2 million, double the amount that the fund eligible. So the AHI staff has been working hard to discuss and to reallocate the limited funding that we have to ensure the service being divided across different areas of service, from vaccination to working to support the people to have access to resources in the county. And we have to make some really difficult decisions. So that whole activity reflects that the need of the Asian American in the county is high. And as I share with you, Councilmember Papanos, I think this is the strategic opportunity for us to really invest into the infrastructure, because this organization will have an interest and have the ability. And I think investing this infrastructure this year and in the future will yield a very important return and build their partnership bridge for the county with the community. So that is the COVID relief effort. The second priority is a continuation of the mental health and the senior wellness program. Like other disparities, the COVID-19 pandemic and the rise of the anti-Asian bias has resulted in a tremendous mental health toll to the Asian American community. So with that, the Asian American Health Initiative has been working to promote and also advance our program to support the mental health effort. And that leads into other program that we also have is on the seniors. 50% of the county resident over 65 are Asian American, and among this group, they have the highest rate of poverty, 12.7%. So with that, we do see the need, the risk for food insecurity, and also that the need to that Asian senior experience due to loneliness and also social isolation in the pandemic. So that has been our focus in the previous year and continue to be our priority in the coming year. And the last priority I will share with you, it is the need to have better investment in data collection and monitoring to reflect the true need of the Asian American community. We encounter a bias about this model minority, right? And that bias will form because the lack of available, robust, and disaggregated data. So we always think Asian American community as just one, without acknowledging the very unique segment and also very smaller community have tremendous need. So in order to understand and dissect it further, we really do need better data. And I mean primary data, both quantitative through survey and qualitative through conversation with the community and community leaders. So those effort is needed so that we can have more robust information to support the effort to serve or to build the capacity for our community. So I will stop there. As always, the Asian American community and the AHI Steering Committee appreciate the Montgomery County Council support for the AHI, and we look forward to the continued partnership and working with you to help serve the community. Thank you.
Thank you so much, Dr. Nguyen. I appreciate you. All right, colleagues, we are now going to enter into the Q&A section. If you have a question for any of the three important boards and commissions that have just presented, please let me know. I will start. I have my own questions, but I'm going to start with my colleagues. So Councilmember Rice, please, you have the floor.
Excellent. I'm going to try and be quick because I know that we have a lot of people today. So let me just start off with AODAC and Ms. Mitchell. I think your idea about student involvement is absolutely spot on, perfect. And so what I'd like to do is ask Vivian, if you could connect Ms. Mitchell with the SWAG group, the Student Wellbeing Action Group, who already has come up with great ideas around mental health and well-being for our children. I know that they would want to play a role in this because we know that unfortunately folks are self-medicating. We've seen a huge rise when it comes to marijuana use, and we know that that's tied directly to getting and trying to self-medicate based on the challenges that many of these students are experiencing and feeling with COVID. And so it's overwhelming to them. We've heard that directly from students. We're also going to be putting out a survey, our youth risk behavioral survey, which should be coming out very soon in the next month or so. We'll get a lot of information off of that as well. And so that will certainly help us and guide us. So I just wanted to say thank you for highlighting that. I agree with all that you've said, but did just want to say as chair of the Education and Culture Committee, we can work with you to make sure that that happens and we get more of that student engagement and involvement. So kudos to you there. When it comes to African American Health Program, Ms. Williams, thank you so much for your presentation. And I couldn't agree with you more. We've got to step up. Our Latinx vaccination rates are about 20 points higher than Black African Americans in our community right now. They were about the same back in April, and now they've dipped significantly. And in fact, the Latinx rates, Asian rates are pretty much around the same in terms of vaccinations. I'll get to you in a second, AHI, but kudos to you there. But so there's work that we have to do. And I think that I heard that from you, Ms. Williams. What I'd like to do is try and mirror the continued success we've seen with Saludi being a star. And so I really want to make sure that we have a detailed plan. So I'm happy that Dr. Kroll is on the line today, because what we need right now is an actual layout of exactly what we're going to do. I know the intentions are there. Everybody's on board and knows what our challenges are, but we need to see something. And so I'd like to request, Mr. Vice President and Chair, that we actually ask for a detailed plan as well as any funding that's necessary to make this happen, so that we can have that before this winter surge, because we know that it's coming. Everyone's talking about it. I know that Dr. Kroll, you and Dr. Bridgers and everyone on your team has warned us about this winter surge. We need to make sure that we have this plan in place, similar to what we did with testing. AHP did a phenomenal job when it came to changing the paradigm when it came to testing. And we need to do the same thing when it comes to vaccination. So that would be my request there. And then for AHI, Dr. Nguyen, I know that mental health has always been, since I joined the council back in 2010, has been something that's an incredible concern, especially amongst our Asian American community. And so I just wanted to get a little bit more of an understanding as to whether or not you've seen a rise in some of those cases, because I know that that's where we focused a lot of our efforts over the years. We know how COVID has played a role. We continue to hear about mental health. We also know the mental health that continues with our Asian American population and discrimination. You just heard it from one of our prize gymnasts who, had something happen to her. And so we know that impacts our students and our children as well as adults. So if you could just chime in on that and in terms of what you're seeing and if there's some additional things that we need to do there.
Yes, thank you, Councilmember Rice, for that question. Yes, we do see the rise in the mental health concerns across different demographics within Asian American community. What I mean is here both at the seniors level people, also in the student. What we have learned from the number of proposals as submitted to Asian American community is as Asian American students in school do experience a lot of stress during this time, and that mental health issue have rise into their concern. So those are come from different community. On the business community, Asian American also have a large business number of business owner, and the COVID-19 pandemic have impacted their work as well. That caused mental stress, and so and to answer your question, that go across the different demographic and also different sub-community. I think that we still, as we observe and we do see that there's a number of smaller community that we didn't have a chance to reach, and we try to reach them. And I think with that, they have less access to resource, they stress even more. So I think there's the ongoing work that we will continue to focus in the coming year.
Great. Thank you, Councilmember Rice. Great questions and comments. Councilmember Glass, and then I'm going to bring up the rear here with my own questions and comments. Councilmember Glass.
Sure. I appreciate all the questions and comments by Councilmember Rice. So I just have a question or comment for each of our groups here. For the African American Health Initiative, Ms. Williams, thank you very much for your continued leadership. And you spoke a lot about vaccine hesitancy. And so I just wanted to hear, what you think is working or what more we need to do to get more members of our Black community to get vaccinated, recognizing that an overwhelming majority of them are, but we need to get those numbers up even higher.
Yes, I agree with Councilmember Rice that there is a need for a detailed plan, and which we would like to discuss certainly with Dr. Crowell as well. But I think that some of the hesitancy issues that this is not a survey, a real survey, but it's just some insights that I've received from various people who have not been vaccinated. They're really concerned about the way they've been treated by the healthcare system in effect. They said they relived those moments where they were threatened as kids, held down, treated poorly, belittled, treated as if, they said they were told to shut up and suck it up, things like that, and rough disparaging behaviors, disrespectful behaviors, and being forced and yanked into taking a vaccine. I mean, this is coming from just general people I've talked to, including some of my relatives.
Sure.
who have not been vaccinated. So they have some concerns about being re-traumatized again.
Right. And I appreciate your candor there, because I think what's important, what you just highlighted, is that the hesitancy is not about the science, right, or the efficacy of the vaccines. It is because of institutional trauma and the way, I'll say, the United States has treated some of our residents here. And so that we need to rebuild that trust, and having a plan, as Councilmember Rice said, doing other things will go a long way to rebuilding.
Not so much about conspiracy theories either. It's a little bit there, but not much. It's mostly being re-traumatized.
Good. Well, I appreciate that, and we'll work on continuing to build that trust and get that plan out there for that. So thank you, Ms. Williams. Ms. Mitchell, you made me think. It was early in the morning, or it was earlier in the morning when you shared your comments, and your comment about renaming the council. I thought about that, and so rather than have it call the Alcohol and Other Drug Abuse Advisory Council, maybe something more akin to Addiction Treatment Advisory Council, right, to what we want. And so I appreciate you elevating that, because clearly the words we use matter, and we don't want to stigmatize, we don't want to marginalize, and we want to make sure that the council or committee or whatever we want to call it, but I know it's currently a council, needs to be open to all. And we need people to be receptive to the messages that you are helping create and deliver. So we're going to ruminate on that one a little bit more, but words certainly matter, and we want to be as inclusive as possible. So thank you for bringing that to our attention. I think now is the right time to make that your council more inclusive and more representative of the work that you're doing.
the council and the language in the charter. It's significant as well because people look to see what we do, and it's important that what they're reading reads as help and not punishment or stigmatizing. Especially even for parents and for students. We have an alarming rate of heroin use and even trying it from our students. And so that's really scary. And I don't want them to go and look at what we're supposed to be doing and read that as punitive or frightening.
Absolutely.
I want it to be helpful and welcoming.
As do we all, and want your message, again, your work to be heard and to be open for everybody. So thank you for that. Adding this to our plate of homework that we need to do. And then finally, Dr. Nguyen, I appreciate everything that you shared, especially your comments about a more data-focused approach. And I've read your testimony, and all of the points I think were spot on. But I do have a related question for you. Over the last year, especially last summer and even last fall, here in Montgomery County and quite frankly across the country, we saw a rise in violence and hateful acts against members of the AAPI community. And I was wondering if here in the county we saw a drop in services or people no longer reaching out because they were just scared or fearful about government services or about bringing attention to themselves.
Yes, from conversation with our partners across the different Asian American community in the county, we do receive input that the Asian American community, they do have that concern. They do know that at the beginning, during the height of all that event that caused the anti-Asian sentiment there, people are afraid to go out and get vaccine during the time that we need to get them to go out to get vaccine most. Right? And people reluctant, sometimes people share with us, they don't know if they should even go to the market. So those parts was very concerning. And we do know and we try our best to educate people and comfort them and let them know that we are at the county in our partnership together try to put in a safety measure to ensure that they can count on their community. But the feeling, scare, true. Okay, so I think therefore the effort to help engage and build that trust is critical. That's why I emphasize on building that infrastructure, that trust and that network. Because without that, we continue to work on patching hole. And when the next pandemic will hit us, it's just a matter of when, rather not if. But we don't want to end up at the same situation as we were just about a year ago. So I think that's the strategic consideration that we should to put in as we move forward.
Well, thank you. And just tying all of this together, building trust among with our African American Health Initiative, and clearly also with our AAPI community as well. We are a beautifully diverse community. We welcome everybody, and we provide services to anybody who needs them. But clearly, we continue to we should continue to work on our trust building for those who might be hesitant, for newly arrived immigrants, or those who have had traumatic experiences with government at any level in the past. And so I, again, appreciate all of your candor here and look forward to working with you to rebuilding this trust and making sure that we provide more services to those in need. So thank you all for being here this morning.
Thank you all so much. So I've got a bunch of questions. There's going to have to be some follow-up because we're not going to get through all of these this morning, but the conversations have sparked so much. So I'll start with our African American Health Program. Once again, Ms. Williams, thank you. I know you and your team have done some extraordinary heavy lifting over this last year and a half. I think there's some real opportunities, specifically the Black Doctors Network, which I know launched, and I think with the right resources and support, really poses some unique opportunities for us to connect communities in ways that we haven't before. And I think the plan that we had discussed earlier should absolutely include an expansion and and really a centralization of those efforts. And I think that you all can play a pivotal role in helping to ensure that that meets its full potential, because it will help both in the networking and the navigation of the patients themselves, but the support structure in place for the doctors, which I think could have some other ancillary benefits of helping to recruit medical professionals here to our community and help create more of a pipeline further upstream as we recruit from medical schools across the country, I think could be really beneficial. So having that kind of an ecosystem, I think would be powerful. Any comments on that or any thoughts on the Black doctors?
I actually have a background from my days at HRSA with the HCOP program, the Health Careers Opportunity Program, back in the 70s, 80s, and 90s. And that's what it did. That was the purpose, to recruit Black students into the medical field in particular, but other health careers as well. So I think that I'm reading your mind. I think I know where to go with that.
Okay, that would be great. And the other thing too, Ms. Williams, you and I have talked about this. I think one of the benefits of the last year and a half is a lot of new organizations and community leaders have stepped up to assist in a variety of ways. And I think there's an opportunity for us to make some investments to help organizations that are already here and could have their services expanded in some way, but also new and emerging organizations that we can identify and help support and foster so that they can grow and expand. I mean, one of the reasons why I think we've had the success that we've had in Por Nuestra Salud y Bienestar is because we've activated, this array of organizations that we're all familiar with that have done outstanding work now for generations at this point, and leverage the relationships and resources that they have in the communities in ways that we as a government can't do by ourselves. And so I would love to work with you all on identifying the names of those organizations. And Dr. Kroll and I have had conversations about this as well, making some long-term investments over a sustained period of time to bring these organizations to scale. And you in so many ways are our eyes and ears, and can help us identify those orgs that you have particular confidence in and think that have tremendous potential. So would love to follow up with you on that.
Yes, I'd love to follow up on that as well. Yeah.
Yes, that would be great. And as we prepare the next year's operating budget and other operating budgets beyond, I think there could be a lot there, because that's how we'll be able to expand our reach and address some of these underlying issues that you so eloquently stated in your testimony, and we know continue to be there, and that we have to address. So those are two. There are many more, but those are two in particular I want to follow up with you all on. So thank you so much, Ms. Williams.
Thank you.
And to Ms. Mitchell, well, amen to everything you said. I think we have to change the name, and whatever you need in the way of support, that should not be a heavy lift, but we would love to take the lead from you all on what you feel would be the most appropriate, because it's much more than just rhetoric. It does send a message. It does permeate a theme that we want to make sure our families feel and hear and sense. And so that would be tremendously powerful. Dr. Kroll and I had the opportunity to attend the vigil earlier this year with the families who lost loved ones to drug and alcohol abuse and an overdose. And it was easily one of the most powerful experiences I've had in the last 3 years in the council. It was an intensely emotional scene and just so depressingly preventable in so many cases. And so we need to eliminate the stigma and embrace and support these families with the love and the support that they need. And Dr. Kroll has been such a leader for so long in this space. And on the flip side, one of the brightest spots of the last 3 years was the opening of the Avery Road Treatment Center, which is an absolutely magnificent facility, and I think is going to save lives in ways that are hard to quantify. I could not agree more about the need for an adolescent space that's similar in its size and scope, because we've been saying this for years, but we should not have our family members and loved ones have to go to jail to be able to receive the kinds of services that they should have been receiving all along. And that, of course, is woefully inadequate for what they need, but we need to be much more preventative there. So we will work with the central staff on whatever it is that we need to do to address those bureaucratic red tape issues on naming, and we'll leave it up to you to make some recommendations on what it should be. But I think that will be a very valuable and helpful exercise, and would also love to follow up with you on seeing how we can start planting some seeds on creating a corresponding facility at some point, hopefully before my kids are totally aged out, to have access, because I think that would be really important for our community. So thank you for those recommendations.
Thank you.
And then finally, Dr. Nguyen, thank you so much. So I'll start with the data collection. Certainly agree there as well. Would love your help. You and I have had this conversation. I think, we often have categories that are dictated by the federal government that correspond to information that we have to provide for federal grants or for the census. But as we know, they are woefully inadequate in terms of being able to clearly tell the story, particularly of our Asian American and Pacific Islander community. And Dr. Kroll and I have had conversations about this as well. I think there's a real opportunity, and I know he's actually been doing some work in this space, so I don't want to steal his thunder. So Dr. Kroll, I see that you've got your hand up. Please, go ahead.
Thank you. No, I was just going to underscore what you were saying, that the disaggregation of the data is a significant challenge across the entire spectrum of our communities of color. The Asian American community, obviously, Dr. Nguyen and I have talked about this as well. So we both know that is an enormous challenge. The Black and diaspora community is the same. It encounters the same experience. What is Black, and how many different cultures, ethnicities, and languages do you have in the Asian American community and in the Black community that are pieces that we never have opportunity to disaggregate? How we do that is important, and then how do we understand that, in the Asian community, one of the challenges that Dr. Nguyen and I have talked about is how do we do assessment, both qualitative and quantitative. The quantitative pieces are made hard by the things we just talked about, but the qualitative pieces are equally challenging given the diversity in the Asian American community. When we went through we're in the process of doing community health needs assessment now, and that process requires focus groups across from the MHIPs. The challenge is how many of those focus groups can we do, how, and what size, and what community. Those are the challenges I'm looking forward to working with Dr. Nguyen on as we go forward to try to figure out how we disaggregate at least the qualitative aspects initially, to make sure that whatever quantitative data we put out is fueled and informed by the qualitative information from the community.
Yeah. Thank you, Councilmember Albanos and Dr. Kroll. And I understand the challenge, and I think that has been the challenge we deal with in the past decades or more, right? And I think that and with that, I just want to challenge us also to start thinking about what we can do, because unless we take concrete action and investment, that challenge will be with us for the next decade. So I think that part, as we acknowledge the issue and the barriers was, so really looking forward for concrete action and the investments that we can help the minority communities overall to have better data.
Absolutely. Whatever you need from us, Dr. Kroll, because I think we could do some really groundbreaking work in establishing those metrics that are here. And that, like in so many areas, Montgomery County leads, and then there have been numerous instances in which our federal government has followed. And so this is another one of those opportunities. And then finally, for now, Dr. Nguyen, I'm not surprised, but heartened to hear that you've had over 30 applications from organizations, that more than 15 have been deemed eligible and even have scored even higher than just baseline eligibility. And as you noted, unfortunately, we're not going to be able to fund all of them in this round, and we are exploring creative ways moving forward of seeing what we can do. but it would be helpful to become familiar with those organizations, even if we're not able to fund them in this round. We'd like to become more familiar with their work. So as an office, we'll follow up with you to see if there'd be an opportunity to visit with these organizations. We could set up a Zoom meeting. I'd like to hear more about what they're seeing, what they're feeling. I know a lot of them are addressing some of the mental health needs that we've talked about, and Councilmember Rice mentioned as well, which we know is a huge issue. And the cultural competency is something that we're going to have to work on holistically across the board. The sad reality is we don't have enough mental health providers right now, period, let alone those with cultural competency. And so we're going to have to get really creative here in establishing a curriculum that our school administrators or after school programs, those organizations that touch children and youth and families the most directly should have access to. And I think there's some opportunities there as well. So thank you, everyone. This is a great start, lots of follow up on, but I was immensely impressed with all three presentations, and you are all welcome to stay with us. Oh, President Hucker, I apologize. Please, if you'd like to make some comments or have some questions, go ahead.
No, I'm just grateful. I think Councilmember Rice got my question about the black and brown gap, and Councilmember Glass got my question about hesitancy. So very grateful to all of you for all your hard work on this, following the discussion very closely, and want to just add my voice to the choir that I want to do anything possible.
Wonderful. Thank you so much, Mr. Council President. All right, we will next hear from our next three groups. Those of you that just presented, you're welcome to stay on, but if you have to get to other things, we certainly will understand. But in our next three groups, we will first hear from our Commission on Health, and specifically from Ms. Jessica Kronstadt. Then we will hear from the Interagency Commission on Homelessness from Jeff Goldman, and Ebony Johnson is here as well. And then in this group, we will also hear from our Latino Health Initiative and Dr. Michelle Larue and Olivia Carter-Pocris. So let's start with our Commission on Health. Ms. Kronstadt.
Hi, my name is Jess Kronstadt, and I am the chair of the Commission on Health. And I'm very excited to be here today with the council members and Dr. Quell, but I think most importantly with our fellow boards and commissions. The Commission on Health has a very broad mission to advise the county about public health needs and priorities throughout the entire jurisdiction. And as such, there's a lot of intersection with the work being done by my colleagues on this call. Some of the themes that I'm about to mention have already been raised by my colleagues, and I'm really excited to explore opportunities for us to collaborate as boards and commissions on this really important work. So I do want to talk about our priorities for the upcoming year. We have two priority areas, one around school health and the other about communicable disease. And I really want to underscore that all the work that we will be doing will be consistent with our real commitment to two overarching principles related to equity and data. So to begin with school health, as you are probably aware, there's a very well documented link between health and education. We know both that students who are healthier can learn better, and we also know that individuals who have additional education tend to be healthier. We also know that there's a lot of research about the link between mental health and the ability to achieve in academic settings. And so this year, the Commission on Health is really focused on efforts to support the smooth transition of students back into the classrooms. To be able to be prepared to learn means both that students need access to the resources for their physical health, which does include vaccinations, as well as mental health and substance use. So I really was very interested in the conversation earlier about the priority about substance use amongst our youth and adolescents. The second focus area has to do with communicable diseases. It doesn't need to be said by me about the terrible, devastating impact of COVID-19, but we're also very mindful of other communicable diseases and the trends in this county, particularly with regard to things like tuberculosis and sexually transmitted infections. There are some pretty alarming disparities that exist if you break down those numbers by race and ethnicity, or by gender, age, and of course by geographic location within this county. We have been very pleased to see that the county has been a leader nationwide in terms of its COVID-19 vaccination rates, but as was discussed earlier today, there are still cases of hesitancy, and we really want to continue the commitment to address all of those barriers, the misinformation, the historical trauma, to make sure that everyone has access not only to the COVID vaccine, but we're also very concerned about vaccination rates for influenza and for other illnesses as well. And so we really want to continue to review that data and understand what those hesitancies and barriers are to make sure that we are able to have high vaccination rates across a range of communicable diseases. And we're hoping that we might be able to learn from some of the lessons about what did work in terms of getting high vaccine rates to be able to apply those to other vaccinations as well. And then finally, as I said, I really want to take a moment to talk about our overarching principles because they really are very important to really supplement the work in these two policy areas. So the first has to do with equity. We're very dedicated to identifying, addressing, and correcting racial disparities within the county. We believe that every resident, employee, visitor to the county should be able to live in a safe and supportive environment, regardless of race or ethnicity. And so we are going to make sure, and we have a work group that's really going to track carefully with all the work we do related to school health, communicable diseases, to make sure that we're really looking at it with a lens of racial equity and social justice, as well as in other ways that we can help as the county is thinking through its public work to make sure that we're really focused on those areas. And finally, we really want to emphasize data. We have been really impressed that the county has taken a very data-driven approach to the COVID-19 pandemic. We really think that's important in everything that we do. We want to continue to bolster, and we have advocated for increased epidemiological capacity at the health department. We've just recently put in a letter in support of having additional data support to look at our healthcare for the uninsured programs. But as was articulated very well earlier today, that's really one step in the process. There's a lot more that we need to do to be able to get the kind of disaggregated data we need to address the concerns throughout the county. That will really require a more robust effort, I think, to modernize our public health data infrastructure. So with that, I'm looking forward to listening to the other presentations, and we'll be happy to answer questions after the next two sessions.
Thank you so much, Ms. Kronstadt. We will circle back after the next two presentations with questions. Next, we will hear from our Interagency Commission on Homelessness. And we've got with us Mr. Jeff Goldman and Ms. Ebony Johnson. I don't actually see them on. Oh, there we go. Mr. Goldman, you are on and you have the floor. Well, while we're working out the technical difficulties with Mr. Goldman, why don't we move on to our Latino Health Initiative, and then we will circle back with the Interagency Commission on Homelessness. We are joined this morning by Dr. Michelle Larue from the Latino Health Initiative. So Dr. Larue, why don't you go up next?
Good morning, everyone. My apologies. My camera doesn't seem to be working. I just wanted to say a quick hello and kind of set the stage for my colleague, Dr. Carter Pocras, who's going to say a few words. I think we've heard a lot of the amazing trends. I mean, data, some historical mistrust issues that we still need to conquer. And I also want to highlight the story of poor little William, who not too long ago lost his life. We want to make sure that not only are we breaking down these barriers, but people know what services are available, especially these great partnerships that we're building between local community organizations and the county, which these partnerships throughout the pandemic have been so critical. But with that, I want to pass it off to my colleague, Olivia.
Thank you, Michelle. We're doing it as a tag team. I want to give a shout out to also Jackie Williams, because we've worked together before, and I look forward to working together with her as the co-chair of the Latino Health Steering Committee. I wanted to just remind us about where we are in terms of the Latino Health Initiative. It is considered to be a comprehensive and a holistic approach to health and wellness. And so it works with stakeholders throughout the county to enhance coordination of existing health programs and services targeting Latinos, develop models of programs and services for Latinos, and providing technical assistance to programs and services serving Latinos, and advocating for policies and practices. And an independent group of volunteer professionals and community leaders, and that includes myself. I'm a professor emeritus at the University of Maryland School of Public Health. The steering committee provides expert guidance and technical assistance for these projects and activities. For fiscal year 2022, we selected 3 policy priorities, reflecting the priorities of the Blueprint for Latino Health in Montgomery County, which ran from 2017 to 2026. So the 3 are maintaining support to curtail the impact of the COVID-19 pandemic in the Latino community. The second is to expand the scope and impact of the Latino Health Initiative. And the third is to increase the number of Latino serving and decision-making positions in the Department of Health and Human Services and other county agencies. While significant progress has been made in addressing COVID-19 in Montgomery County, the Latino community continues to lag in various indicators, including related cases and deaths in the county. Latino communities are at high risk and need due to a variety of social and environmental factors, including underlying health conditions and occupational and residential exposures. These disparities are not new, and neither are the recommendations and steps needed to address them. I want to thank the council members for mentioning the success of the Bienestar program. We literally could not have done this without your support and that of the county executive. The COVID-19 pandemic underscores for all of us the importance of addressing social determinants of health as part of a public health response to a crisis. This includes language, literacy, food insecurity, housing, etc. With Salud and Bienestar, we have expanded the reach of the LHI with case management and connection to food and other resources in our community. And we feel quite strongly this is something, even after the pandemic is over, that we need to have in place in the county. We also recognize we need to diversify the methods that are needed to reach out to communities that do not rely on internet access. And we also recognize that prevention and promotion of health does not start and end in the doctor's office or clinic. In regards to the earlier discussion about vaccine hesitancy, I'd like to draw your attention again, as we mentioned in an earlier meeting with Dr. Crowell. In October, the Annenberg Public Policy Center found that less than half of unvaccinated adults have had their physician discuss vaccination with them. We need to recruit all healthcare providers in the county to help get the message out, not just those that are funded by the county. Recently, we received the good news that COVID immunizations were approved for use among children ages 5 to 11. I'm pleased to say that my 2 grandkids got vaccinated yesterday. But through the Bienestar program, the Salud Bienestar program, our county was prepared to immunize kids the very first weekend, which was wonderful. Targeted efforts are still needed since Latino children represent over 40% of the county's school-age population. Unfortunately, recent assessments have found continued hesitancy among Latinos to get vaccinated, especially Latino youth. So yes, we've had success, but that doesn't mean we'll continue to have success. We still need these targeted efforts. We also agree that testing is important to continue. Vaccination by itself is not sufficient. This is important since not only are children getting sick from COVID, but they can also pass on the virus on to others even more vulnerable. Death and long-term effects after COVID-19 do occur in children and adolescents. Going forward, our county needs to be prepared to address the effects of long COVID and the impact of delayed care in our communities due to the pandemic. Our steering committee members, as you heard from Dr. Larue, are very distressed with the recent death of the 11-year-old who was residing in a county homeless shelter. I look forward to the discussion. Thank you.
Thank you so much for those comments. I have some thoughts and questions we'll get to in a minute. I've just been notified we've been joined by Ms. Helga Luest, who will be representing our Interagency Commission on Homelessness. Ms. Luest. Oh, no, sorry. Did I get that wrong?
She's with our Mental Health Advisory Committee.
Right. Got it. Okay. Sorry about that. So we don't have anyone here from the Interagency Commission on Homelessness?
Not right now. I'm actually checking with staff to see if anyone's coming, but so far no one's on the meeting.
Mr. Goldman was on, but then was not on. So I'm not sure if he had technical difficulties or not. Well, why don't we start with these two wonderful panels then? And I can go ahead and kick us off with some questions here. So I want to start with our Commission on Health, and you gave, and thank you so much for the testimony you gave to the full council, which I think is a really great practice for all of my colleagues to hear your recommendations on an annual basis. And I mentioned then that I would be following up when you presented to us today, so that is right now. With regards to the emphasis on data, and we've heard that as in other groups as well, if you could get a little bit more specific, if you can, and where are the areas that you all believe, Ms. Cronstadt, that we need to make some investments? Is there an opportunity for us to expand on existing efforts, or is this more of connecting the dots among respective organizations, in your opinion, or I'm sure it's probably all of the above, but any other insight you can share on what that might look like? And once this work group meets, I'd love to come and meet with them and have a more extended and more granular conversation here, but any other insight you can share on data collection would be great.
Sure, I would love to. So I think there are a couple of different things. So first, the very concrete ask that we put forward to the county executive has to do with having an additional staff person who can be responsible for taking in all of the data that comes in from the various clinics and other providers who participate in the healthcare for the uninsured program. There's a lot of rich data there, and we just don't have the capacity to be able to take that in, compile it, analyze it, look for trends on a regular basis to be able to use that for, improvement, evaluation, et cetera. So that's a very, very tangible ask. I think for some of the other pieces, and I'm speaking a little bit from me, somewhat from the Commission on Health, but I do want to just provide that caveat. I think part of it is we do have, if you look, we looked into this a couple of years ago, and the FE capacity for a health department of our size is very limited relative to even some of our peers in Montgomery County. So I do think, simply having additional staff will be helpful. HHS has done an amazing job developing partnerships with other universities, and I think we should continue to leverage that and really take advantage of that additional capacity. But it does seem like having some more information in-house to be able to take the data that we have, be able to do, they've done great analyses about, looking at zip code, different health conditions by zip code. It's just time consuming to do that. And I think the other piece, which was articulated earlier today, there's also a need for that qualitative data collection to be able to, my understanding is that we've expanded the number of languages that we're translating some of the surveys for as part of our community health needs assessment, but if there's still more we could do, even just to be able to reach individuals with different languages. And to understand, to really know the health needs and to be able to get in depth to understand things like, what's behind vaccine hesitancy. There's only so much you can do from surveys. Some of it you need to take the time to talk to people, and that's a huge, that's labor intensive. And so something that we really need to collaborate amongst, use all the resources we have, but consider additional resources. The other thing I'll say about data is there are a number of national initiatives right now that are looking at data modernization. The Robert Wood Johnson Foundation just put forth a report from a task force on looking at transforming public health data systems. And so I would really encourage, and I know the Commission on Health is eager to do this too, and we would love to speak with you about this, is to really pour through those recommendations that have been coming out on a national level and to see which ones make the most sense within our county so that we can, as you said earlier, I believe it was you said, that we can really be a leader in the country in terms of really transforming our data systems. And I think that's going to take being really involved in these national networks to sort of learn what those cutting edge trends are and see which ones we can apply in this county.
I appreciate that. That is incredibly helpful. I think a session in the future specifically on data collection probably would make sense. And I'd love to follow up with all of you on that, because there's so many layers to this, and it's a consistent issue across the board and has been for quite some time. So I think there's some opportunities there. Just last thought or two for our Commission on Health. I was really struck by your comment about, the connection between health and education. The chair of our Education and Culture Committee also happens to be on our HHS committee, and Councilmember Rice has been a tremendous leader in making this case and making this link now for I had the opportunity to watch his work when I was in the executive branch previously, and so he very much understood. You had him earlier than hello when you made those comments. But it strikes me, though, and this is a little bit of a homework assignment, if I may, for our Commission on Health team. Recruitment and retention issues are a huge issue right now among our providers across the board. And it's one thing to establish a plan and a strategy, but if we're having a hard time just retaining the folks who are overwhelmed by everything that has happened over these last 2 years and are leaving the field in record numbers, and thus having a hard time with recruitment, it's not a sustainable situation. And so if there are best practices that are out there, if there is an opportunity for us to analyze compensation, if there's a way that we can provide more support for our frontline medical professionals, from nurses to social workers to case managers to our doctors, that would be helpful. And you have such a rich array of people that make up your board that are in the field and that are probably they themselves feeling some of this pressure and anxiety and anxiousness. And so I'd love to have a broader discussion with you all and even receive potentially some recommendations moving forward on what we should look at doing as a county to see how we can support folks. So I'll stop there on our Commission on Health. And then finally, for our Latino Health Initiative, first of all, my goodness, thank you all. It really is groundbreaking. I had the opportunity to attend, along with Councilmember Navarro and the county executive, the recognition of the anniversary of the launch of the Latino Health Initiative. And there were over 74 organizations that received citations from the county executive, acknowledging and thanking them for their partnership in carrying out that work. But one of my favorite moments of that whole night was when all 60 of the health promotores came on the stage at the same time. It was just such a powerful moment to see these remarkable, almost all women who are in the community, establishing connections and really enhancing trust in ways that even health officials can't on their own. And so that, coupled with the Abuelina initiative, was really powerful, and one that we need to sustain moving forward. And I've already had numerous conversations, both with Dr. Kroll, with Dr. Bridgers, with a number of folks within HHS and among our providers on where we go from here with this great momentum that we've built. How can we expand that and expand it to our other minority communities as well, which I think will be really important. So, and I couldn't agree more regarding the tragic issues are revolving around little William. We know that we have a large number of people who are coming from indigenous backgrounds, and that's an area that we have to improve upon. We've talked about this. It's not going to happen overnight, but we have to provide more culturally competent care. In the Mayan language alone, there are more than 30 indigenous dialects spoken. And so there are dozens and hundreds more out there. So that is an area that I think we're going to have to make some investments in. But thank you all so much. I'm already so familiar with your all's work, and we talk often, so I don't have questions for you all today, just mostly an acknowledgement of thanks and agreeing with all of your comments. With that, I will yield to Councilmember Rice, who has some questions and comments himself.
Well, just very quickly, and Mr. Chair, you've summed up a lot of it. I will just say, when it comes to the Commission on Health, and especially when it comes to school health, this is something that we just continue to grapple with in our conversations with MCPS, as well as DHHS on what the best way for us to move forward is, seeing that this is a problem that is gripping the entire nation. And it's built upon something that was an inequity that existed far before COVID even started. I mean, thanks to the council and to the Commission on Health, who already had told us and given us recommendations that we needed to increase our cohort of school health nurses and mental health. We had already started on that journey. So thank you for the great recommendations pre-COVID that made sure that we were already on there. And thank you to Dr. Kroll, who I think is, there he is, still on, because the Department of Health and Human Services did that work and started really laying the groundwork in terms of getting folks. But this is something where, similar to bus drivers and other kinds of things, we continue to struggle with. But I'll tell you the difference, and everyone knows this, while it might be a child being late to school or having to be driven to school, we're talking about the mental health and well-being of our kids. And so I just go back to our SWAG group to again say that students leading in terms of identifying what they need, working with folks like Dr. Kroll and his team to make sure that once they hear what our students are saying that they need, it might not always be the exact thing. It may not always be a school psychologist that a student may need, but they may need something else that still gives them that sort of support, that person to talk to. Those are the kinds of things that are going to be incredibly important to help us to move forward. And so it's, again, the same sort of thing as we analyze and break down the recommendations that came from the SWAG work group as well as RSSSW. We are compiling all of that information now to come up with a comprehensive plan on how to move forward. So I just want to say, Jess, thank you, because we are going to utilize all of this together to come up with a way in which we can start to address even more comprehensively. We've already been addressing it, but even more comprehensively address the needs of our kids in our schools and also our teachers and administrators and staff. Let's not forget that it's very hard to help someone if you yourself need help. What do they always say on the airplane? Put your mask on first before turning to your child and putting their mask on. And so it's the same sort of thing. We see it with our first responders. We see it with a number of the cohorts of public service people in our communities. And so we're really going to have to step up and come up with many comprehensive ways, including social and emotional learning as a key component of how we are giving our kids the tools necessary to navigate through this. And I apologize for taking a little bit longer, Mr. Vice President and Chair, but this is a really important topic that I just want folks to understand that we're paying very close attention to. We are coming up with a number of different ways in which we can respond to make sure that we're addressing those needs. So just wanted to say thank you very much. And to LHI, look, you guys are gold star. You know it. We've seen the great, incredible work that you've done. And it's a testament to why everybody wants to mirror what it is that you've done and do it for all of their various communities. So just want to say thank you for your tremendous work. Thank you for the continued partnership and the offering to continue to work together, especially Ms. Prochorst, what you said about Ms. Williams and continuing to work with our African American Health Program, with our Asian American Health Initiative, to give them the tools that you guys have been able to utilize to really make some tremendous ground. We've seen it. Doesn't mean that there aren't still disparities. Doesn't mean that there still aren't things that we need to work on, but you guys have done an amazing job, so thank you. Thank you, Mr. Vice President. Back to you, sir.
Thank you. Councilmember Glass.
Well, thank you very much. Again, I appreciate everyone continuing to talk about data collection so that we can use our taxpayer dollars and invest them in your organizations and your missions properly, right? And help direct them where they're most needed. And clearly these are all worthy and really important programs. And Ms. Kronstad, one of the things that I want to elevate a little bit more that you spoke about, but is also in your written testimony, is about the communicable diseases, right? And specifically STIs. Because when we look at the maps and all of the maps for a very long time have all shown the same communities with the same needs, and COVID exposed that for everybody to see. the maps where COVID was most prevalent or continues to be most prevalent are the same communities that need a lot of assistance as well, not to mention higher rates of STIs among students in schools. And so I really do appreciate you elevating that, and let's see what we can continue doing to get support for our students so that they can be healthy teenagers back in our schools as well. So we can continue those conversations. And then just real quickly, Dr. Larue and Dr. Carter-Pokris, LHI, the success that you have been able to achieve speaks for itself. And there's nothing that I can do during this conversation to bring you more credit or recognition than you've already received duly. But I also want to extend my appreciation to my colleagues, most notably Chair Albornoz and Councilmember Navarro, also for their effort to make sure that LHI really has been leading the field, and the data that we keep talking about is proof of that. So keep up the good work. And while there is still more work to do, we are partners in this effort, and I appreciate all of your leadership. So with that, I'll yield back, Mr. Chair. Thank you.
Thank you, Councilmember Glass. We actually now have been joined by Ms. Ebony Johnson from the Interagency Commission on Homelessness. Thank you so much, Ms. Johnson, for joining us. To our other two panelists, again, you're welcome to stay on, but if you have to tune off, we will certainly understand. So we will now give the floor to Ms. Johnson to make her presentation on behalf of the commission. We will then ask questions and then go to the final group of 3 boards and commissions. But Ms. Johnson, the floor is yours.
Good morning. Good morning. Again, thank you to the council and to all of my fellow chairs for being here. And again, I just got notification that I need to be present at this working session, but the Commission for the Interagency Commission on Homelessness has been doing great work in the midst of COVID. And again, we continue to follow our strategic direction. So, in January 2020, the ICH launched the new strategic plan to end homelessness. And that was a culmination of meetings with key stakeholders to include elected officials, the nonprofit providers, and representatives throughout our community. And some of our bold goals, of course, we achieved ending homelessness amongst veterans in 2015. We achieved ending homelessness of the chronic homeless in 2019. And then our goal for 2020 was to end homelessness amongst the families with children. And then for 2021 is to end homelessness amongst youth. And with that, to actually open up our youth drop-in center. And it was supposed to open in June, but that's been pushed back to hopefully the fall to open up that youth drop-in center. Some of our strategies are to reduce the racial disparities across the homeless system or the COC system, to build and support strong and adaptable programs, to build and support affordable housing solutions, and to coordinate effectively across other systems of care and increase and diversify funding. And speaking of that, we just had the Nofa Allocations Committee meetings and also the COC applications for this year. So we've been proactively working with that and also soliciting new organizations to possibly join and submit for the Nofa and the COC competition. And then again, collectively, we're trying to educate and advocate for change. And today, we actually have a session for the workforce planning group to talk about implementing like workforce planning and hopefully coordinating with other partners to get people back to work or to give them opportunities and training and development for work. And with that, again, I was not prepared for this session. I just was notified like literally 5 minutes ago. But again, if you guys have any questions, issues, or concerns, please let me know. And I am so grateful to be here today.
Well, Ms. Johnson, you can play for the Nationals because you just hit a great curveball out of the park. That was really impressive, on the merits, but let alone that you had to do this on the fly. So thank you for that leadership and dedication. It just speaks to your scope and just knowledge of the subject, which is so clear. So thank you so much. I'm actually going to turn over to Councilmember Glass to make some comments and ask our first series of questions here as our lead on homeless and vulnerable populations. I'll just note that it was last year that Councilmember Rice, actually almost 2 years ago now, that Councilmember Rice, Councilmember Glass, and I all participated in the homeless count together on a cold evening not long ago, around this time 2 years ago, just as the pandemic was really ramping up. And so we'll look forward to participating again in the future because it is an enlightening exercise and an important one. But Councilmember Glass, the floor is yours.
Well, thank you very much, Mr. Chair and Ms. Johnson. It is an honor and pleasure serving with you and Mr. Goldman and all the other members of the ICH, and to help push the agenda of that body and to elevate all the needs and service requests from our social service providers here in the county to make sure their voice is heard on the council. That's how I view my role as the lead of on homelessness and vulnerable communities. And this committee has been incredible in helping modernize and update the ICH regulations so that more federal support can come to the county and that ICH can use those funds as in a data-based, detail-oriented way to make sure that we are helping as many people stay in their homes and help provide homes for those who need them. And I know that last year we could not participate in the point in time count because of COVID restrictions. I'm hoping that this year we can hit the streets again to walk around with you and so many other community partners to see your work in action. And that work has proven to be successful in the sense that fewer and fewer people are experiencing homelessness. And the work that this council has done and this county has done over the last 19 months of this pandemic to recognize that the safest place to be during a pandemic is in a home. And all the efforts that we have collectively put forward to make sure that nobody becomes homeless, and to make sure that those who are homeless are socially distant and are afforded the health care and the accommodations that they need to be healthy and safe. And that has resulted here in Montgomery County in having a test positivity rate of less than 2% for those people who are experiencing homelessness, which is an incredible testament to everybody's collective work. And so, Ms. Johnson, I just want to say thank you for all the guidance and counsel and ideas that you and ICH members have been putting forth. And I look forward to working with you on these efforts and my colleagues as we enter winter to make sure that homelessness is rare, brief, and non-recurring here in Montgomery County. So thank you very much.
Thank you so much for those comments, Councilmember Glass. I just had a couple of questions, and just the first is an observation. The homeless issue across the country has exploded. It's become a huge issue, particularly in San Francisco and the District of Columbia, especially in our more urban settings. Tent cities have been erected in cities across the country, and we haven't seen that here in Montgomery County. And I think a lot of that, frankly, is because of the infrastructure and foundation of community-based organizations, support services, and I was very impressed recently by the presentation from Ms. Amanda Harris and her team regarding the efforts underway and the new facility that will be operated by MCCH in the very near future, which is ahead of schedule, and I think presents another unique opportunity to expand on this infrastructure and growth. But Ms. Johnson, one of the things we talked about in that session was the need for us to have a coordinated regional approach to address the homeless issues. And Ms. Harris has mentioned, and I have had the opportunity to participate, and Councilmember Glass has led conversations through our Council of Governments. Could you talk a little bit about, from the Commission's perspective, on the importance of working regionally with other communities? And if you are aware, are there corresponding commissions that you all connect with in the District of Columbia and Prince George's County, maybe even Northern Virginia, because as we know, this is a holistic issue that impacts the entire region.
So yes, and thank you so much for asking this question and just for considering this. I actually sit on the DC Youth Homelessness Council, and that's been very effective as far as just the cross collaboration as far as dealing with our youth, right? Because initially when I came on the council, it was, oh, there are no homeless youth, or there's only 12 homeless youth, and that's not true. In the sense of we do have homeless youth, and DC has like a great approach as far as finding the youth, doing the outreach, and servicing the youth. So those type of collaborations are effective as far as just best practices. And also one thing is the way we approach the homeless, like in the business districts, like you talked about the tent cities. So Silver Spring Council had issues where it was the business owners versus the homeless community. So we actually reached out to DC as well to talk about how businesses were interacting with the homeless. Like they actually had a special committee to really get the business owners buy-in, like where they pay like a special tax or fee, and they actually employed some of the homeless and or provided like services and support. And instead of calling the cops or the police, like if they had issues, you know, they had dedicated numbers to call. So that type of collaboration is important, again, for the best practices. And then, of course, because sometimes we have more resources and services, so we have like cross-collaborated and just talked about what that looks like as far as providing the support to each other. So yes, we do sit on like multiple commissions. Sometimes we'll attend the different commissions meetings, and also we'll interact and cross-collaborate with information and best practices.
Thank you. That's really helpful. And then the last is just a comment, and the Councilmember Rice has a comment and question as well. But last one for me for now on this is we are starting to work on the development of essentially a broad coalition to apply a little bit more pressure at the state level on those policies that become barriers or challenges in us for us to be able to fully provide the services that our homeless population needs. For example, there are not a sufficient number of mental health beds in the entire system across the entire state. And there are policies and practices that sometimes make it more difficult, particularly for family members and loved ones who have a family member or loved one who is homeless and who they're trying to provide support for, but run into roadblocks where they're not able to make the referrals that they need to be able to get these individuals the help they deserve. And while we have tremendous community-based organizations, too many to mention, that are directly involved in this space, they have shared with us their struggles and challenges in seeing the cycle that is in some cases hard to break because of those barrier issues. So would love for you to and the commission to join that voice because we are working on preparing sort of coherent, specific recommendations at the state level in anticipation of this upcoming legislative session that we hope will continue the efforts of a number of our colleagues within the delegation, will provide them with the ammunition and support that they need to add to the urgency of this because it is a growing issue, especially on the heels of what we're experiencing with the pandemic and how many people are food insecure right now and transitioning between jobs. The problem's going to get worse before it gets better. So thank you so much for those comments, Ms. Johnson. Councilmember Rice, and then I see Council President Hucker may have a question or thought as well, but Councilmember Rice.
So just very quickly, when it comes to our homeless population, I just really want to thank Councilmember Glass for continuing to work with me. Hopefully, we will have something shortly that involves a proposal that really focuses on what's happening right now with many, especially our families with children and some of our young people when it comes to workforce and employment. Something that I know that many of our independent agencies and nonprofits continue to work on each and every day. We want to help to stand that up and make sure that folks are, during this incredibly tough time that we're seeing with COVID and the effect that it's had on the economy and on the workplace, that we can keep folks as stable as possible. Of course, that comes with stable housing, but also comes with stable employment. And so from that perspective, we should have something shortly. So just wanted to highlight that, but it ties directly into our strategies. With the other ones, especially with veterans homelessness, it was working with our federal delegation, including Senator Chris Van Hollen, when it came to getting those fast vouchers. And so that was key. When it came to some of our chronic homeless, it was working with HHS and providing mental health services and some of the wraparound services that were there, as well as the housing. And now that we're dealing with some of our families, obviously a lot of that deals with them and having stable employment and having the ability to just be able to make ends meet, continue to have food on the table, pay their bills, and be able to remain stable. And with our young people, it's the mental health piece as well as some of the employment as well. And those are a lot of the people that we oftentimes see who are seeking assistance from our general community. And so from that perspective, the more that we can do to help stand them up so that they can be self-sufficient is incredibly important as a part of that ongoing journey to make sure that those bouts with homelessness are, as you heard from our lead, very infrequent and non-reoccurring. So from that perspective, I just look forward to working with him in that respect. And then, of course, obviously with the entire council. So back to you, Mr. Vice President, excuse me.
Thank you, Councilmember Rice. And I appreciate your creative efforts to try and address this issue from a number of different angles. I know you've been at the forefront in trying to find solutions and really move the needle. And I give you a heck of a lot of credit for that. This is a tough issue, and I just appreciate you trying hard to move this forward. So thank you. Council President Hooker.
Thank you, Mr. Chair. I'm good. I'm very happy to hear about the state effort for advocacy for relief in Annapolis. I'm happy to help with that, but that absolutely needs to be part of the solution, has for quite a while. Thank you so much.
Thank you. And Dr. Kroll sent me a text. He is en route to his next meeting, but is continuing to tune in, but he's doing it from his car, so he is not on video, but he is listening and already is taking, I'm sure, many notes along with his staff. Well, thank you so much, Ms. Johnson. We appreciate you coming on board. And so last but not least, we have the final panel for this morning. We have representatives from the Mental Health Advisory Committee, the Montgomery Cares Advisory Board, and the Victim Services Advisory Board. And so we will start with our Mental Health Advisory Committee, and we will hear from Garrett Manchin. No?
Garrett.
Oh, my fault. That was my fault.
Okay.
No, Ms. Helga Luest. Ms. Luest, I got the note, and I just forgot to connect the dots. So please, you're on.
No worries, and thank you so much. Good morning, everyone, council members, Dr. Crowell, and the committee and commission members. The Mental Health Advisory Group has been very busy over the past year, and we have two top priorities for this year and some that are staying on our radar as priorities. So I'll begin by just talking a little bit about our county crisis services. The Mental Health Advisory Committee wants to thank the County Council for increasing funding provided for the county's mobile crisis services over the past 2 years. That enabled the county to move from from one team to 6 teams, operating the number of mobile crisis teams throughout the county, and they're operating 24/7. So that's been a huge help. We fully support the county's plans to restructure the mobile crisis teams, which currently consist of 2 licensed therapists, to include 1 additional licensed therapist and 1 additional peer support specialist. In the coming year, the Crisis Services Subcommittee will monitor the hiring of these new positions and the implementation of new policies. And we strongly encourage, as some of the other committee chairs have mentioned previously, that we hire individuals with diverse cultural backgrounds that reflect the diversity of our community, with a prioritization and focus on individuals that are bilingual and multilingual. The Crisis Services Subcommittee also encourages the County Council to direct funding to build a state-of-the-art restoration center. That facility would provide 24/7 urgent mental health care, crisis stabilization, referral, and treatment services. The County Council, we also want to encourage the County Council to promote and support mobile Response and Stabilization Services, MRSS. It's a national best practice that addresses crisis, maintains children in family settings in the community, and reduces the utilization of emergency departments, inpatient hospitals, and residential treatment. Our second subcommittee and priority area is environmental impacts on mental health and resilience. This is the first time the Mental Health Advisory Committee has taken a focus on being proactive with this committee. So in addition to looking at the mental health impacts of COVID, we're also looking at the mental health impacts of climate change. As you all know, Hurricane Ida came through our community and resulted in the flooding of some apartments and subsequently 2 deaths. And so we're very aware as a committee. This was just one extreme rain event. And as our climate continues to warm and we have more frequent and more intense severe weather events, that we realize that there's, in addition to a health risk, also a mental health risk to our community. So the Environmental Impacts on Mental Health and Resilience Subcommittee is focusing on the Climate Action Plan, the Department of Environmental Protection, the Montgomery County Public Schools, and county-sponsored climate change and emergency preparedness events, so that we have an inclusion of mental health. The climate change work groups that the county facilitated also resulted in the development of a health frame, and yet that health frame does not include a mental health component. So we've been working very closely with the Department of Health and Dr. Santiago, who's the Chief of Behavioral Health and Crisis Services, to ensure that mental health is also considered in those preparedness and action plans. And then we also want the Mental Health Advisory Committee to partner with environmental groups and other committees working to address climate change to raise awareness of the growing body of research linking climate change to mental health concerns. There are a couple of other priority areas for us. Of course, the legislative subcommittee, we are just forming to support some of the activities that will take place in Annapolis in the first quarter of next year. We continue to have a focus on suicide. We were planning to, or thinking about having a third subcommittee on suicide because of the increase in suicide and suicidality. But because the county has a larger committee, we've decided to just have representation from our Mental Health Advisory Committee on that larger effort. We also are looking at residential services and intensive outpatient treatment. So that becomes sort of a peripheral topic that we're also focused on. And then I just wanted to mention some statistics going back to COVID and the mental health impacts of COVID, because we're all very aware of that. The Kaiser Family Foundation found that anxiety and depressive disorder went from a national average of 11% in 2019 to the post-COVID prevalence of 41%. And individuals with sleeping disorders or sleeping issues, 36%, eating issues, 32%, substance use, 12%, and worsening chronic conditions to 12%. So we're very aware that COVID has had a very strong impact on our community. And that's partly why we are including COVID as part of our overall work on the environmental impacts on mental health and resilience.
Sorry, I was on mute. I do have some questions I'll follow up on after we hear the other two presentations, but thank you so much for that. Next, we will hear from our Montgomery Cares Advisory Board and Mr. Wayne Swan.
Good morning, Chairman Albanaz, Council Members Rice and Glass, Council President Hucker, and Dr. Kroll. In fiscal year 2021, the Montgomery Cares Advisory Board focused on programmatic gaps, budgetary concerns, and monitored the COVID-19 pandemic effect on residents accessing care. The MCAP continues to focus on its scope and mission, covering programs of the healthcare for the uninsured, including care for kids, maternity partnerships, dental services, healthcare for the homeless, as well as the Montgomery Cares program. We recognize that we are in a time of healthcare transformation where activities focus on improvements in coordinated and continuity of care. As requested, we identified two priorities. The first priority is to support the acquisition of necessary resources for value-based care, specifically to achieve a successful transition to a value-based care approach as a best practice and service delivery model will require additional investments in resources to cover costs and support increased clinical and behavioral care services, robust case management, data analytics, and care outcome quality measurements and improvements across the safety net. Transitioning to value-based care for primary care, dental care, and care for kids services can be successfully achieved only with the requisite additional resources and administrative support. Our second priority is to support collaboration between county dental services, private dental care agencies, general and special dental providers, and dental labs, specifically to develop a collaborative sharing approach to expand the scope of care and increase access to care for the uninsured, underinsured, and low-income population in Montgomery County. This will promote appropriate communication pathways, integrated coordination, and workflows to leverage the capabilities of the dental safety net providers in the county. We want to thank you, the council, and the county executives for the continued support in these efforts. As a footnote, we also echo the Commission on Health's support of the need for data analytics and a more robust approach to collecting and actually disseminating data. And I'm ready to answer any questions that the council has.
Thank you very much, Mr. Swan. We'll get back to questions after hearing from our final panelists for the day with our Victim Services Advisory Board. And we will be hearing from Ms. Catherine Ponser.
Good morning, Chair Albornoz and Council Members Glass and Rice and President Hucker. We appreciate the opportunity, like everyone, to testify and to bring all the stakeholders together to discuss these issues. I think, as you know, the Victim Services Advisory Board is concerned with the needs of crime victims. Largely driven by the pandemic crisis, the demand for help from crime victims has escalated across all county agencies. One priority that we've met with you on is the need for both one-year bridge housing with case management services, as well as improved access to permanent housing for victims of domestic violence. The county's fiscal year 21 operating budget expanded the number of slots available in the rapid rehousing program designated for individuals fleeing domestic violence. Excuse me, but stats from the Betty Ann Cranky Shelter indicate that only 2% of fiscal year 21 discharge clients received rapid rehousing services. What is still needed is funding for crucial case management services. A one-year transition program can help break the cycle of violence and dependency and afford victims time to build needed life skills. We are encouraged, I should mention, to see that the county was eligible to receive $671,000 for a domestic violence bonus project as part of the HUD Continuum of Care 2021 competition, and we will monitor the success of this project for potential expansion. Excuse me, our second priority concerns HHS trauma services. As we reported to you last November, at the beginning of the pandemic, the program saw a 91% increase in service requests. Now for fiscal year 21 and the beginning of 22, the program has received 2,387 service requests. Now, both the therapists and victim assistants have wait lists. Additionally, therapist positions are needed to respond adequately to the substantial demand for counseling. The therapists currently carry caseloads of 30 to 40 people, necessitating their seeing 6 to 8 victims daily. This schedule leaves them very little time to maintain their clinical paperwork, perform intakes, and keep up with other responsibilities. Trauma services also needs to convert 2 existing grant-funded part-time positions to full-time merit positions for victim assistants. It's the victim assistants from HHS Trauma Services who work with victims in district court with peace and protective orders and in circuit court with criminal cases. These VAs also process the county's crime victim compensation cases, and these claims help pay for medical bills, lost wages, funeral expenses, and property losses. Past budget cuts with the loss of 3 VA positions has placed additional burdens on existing staff and caused substantial delay in processing compensation claims. Recently, our board met with representatives from the state's attorney's office, the Police Special Victims Division, the Shady Grove Forensic Medical Unit, the Family Justice Center, and the Human Trafficking Prevention Committee of the Commission for Women to discuss the challenges facing the county in serving crime victims. Over the next year, we will more closely examine the preparedness of the county to provide a multi-agency approach with proper staffing and funding across all programs to meet the needs of the community. I should also mention that in our written testimony, we have listed other areas of concern, but we stuck with the requirement of 2 priorities for today. And I also want to mention that we have considerably, as an advisory board, stepped up our legislative activity. Last year, we supported 7 bills in the General Assembly and 2 bills in the County Council, and we welcome any input from you as to, areas that we may want to consider supporting. Thank you.
Thank you so much for that incredibly thoughtful testimony. I'm going to turn it over. I have some questions and comments, but I'm going to turn it over to Councilmember Rice first.
Well, thank you very much, Mr. Vice Chair and or Mr. Vice President. Sorry, your twin titles always get me caught up. So, so I want to start off with the Victim Services Advisory Board because a lot of people don't know that I actually started with, then it was VASAP before it became Victim Services Advisory Board, well before I actually joined the Montgomery County Council and before I entered into elected office, period. And I was assigned by then County Executive Leggett because my family had experienced, unfortunately, a tragedy in our family. And so it's something that's very personal to me. It's something that I see as continuing to be a challenge in our community as a whole. And so thank you, Ms. Sponsor, for bringing up about, especially when it comes to domestic violence and the continued rise that we've seen during COVID, and those numbers have spiked tremendously. And so while we have programs that are certainly assigned when it comes to addressing this issue, I think that we may be a little bit overwhelmed. And so really having, and I do support converting those positions to full-time merit. I think that it would be wise of us to do so, understanding that we are nowhere close to being out of the repercussions of the pandemic, right? And so while we may have addressed some of the health issues and are getting people vaccinated and boosters and all that kind of stuff, the stressors that existed for so long are still manifesting themselves in terms of these rise cases of domestic violence. And we see it continuously. And so making sure that we also have the bridge housing. And thank you for highlighting that because a lot of people don't know. And that brings me to the last point, which is that, again, for all of these programs and how we're outreaching to folks, we know that it's getting to some, but we know that it's not getting to all. And how best can we continue to serve our communities? And Mr. Vice President, you highlighted it when we talked about young William. And it's just the simple fact that the services are there, but people don't know that they can avail themselves of them because we're still not reaching them, whether it's language comprehension, whether it's just awareness as a whole. And we've got to continue to put forth this effort of making it happen. It's not to minimize the work that's going on. There's great work that's happening, but we've got to do more because we know, just as you said, that the sponsor, a lot of people aren't availing themselves at the end. We see that it's there, but then folks aren't taking advantage. We need to figure out why. We need to understand what some of the stumbling blocks may be so that we can eliminate them or continue to push for folks to understand just how important it is. And again, it's just really important work. So I really appreciate you doing and highlighting these issues. It's going to be incredibly important for us moving forward as we enter into these next coming years, where we know there are going to be so many stressors as people continue to have problems with job security and other kinds of things that will continue to, unfortunately, lift the number of people who experience domestic violence. And so we've got to do our part. So thank you. Back to you.
Thank you, Councilmember Rice. So just a few questions and thoughts. I'm going to start with our Mental Health Advisory Committee. So it is overwhelming to see the need across the board in every category, and it's impacting every generation, every economic social group, every part of the county geographically as well. And the sad reality is that we don't have the number of professionals, again, going back to earlier comments, with cultural competency, but just period, to meet the demand, because the caseload that's rising to a clinical need is going through the roof, and we're not able to keep pace. So, and we're going to have to do everything that you all mentioned and more to help recruit and retain those professionals that we desperately need right now. But I wonder, from a prevention standpoint, this is not insignificant in that, breathing exercises, specific and concrete tips we can take as individuals to alleviate some of the stress and strain that we're all feeling right now, before it gets to, a crisis, or when we see loved ones who are in crisis. How can we support them? What can we say? What can we do to give them the love and support that they need? What would you recommend, Ms. Lewest, in terms of, services or a website, or some of those prevention-based services that we may be able to tap into, and acknowledge we're all in this together, and we all know it's a problem, it's an issue, but we need more solutions. Any thoughts on that?
Yes. So, part of the reason why we have this environmental impact on mental health and resilience is that resilience piece. We realize that we can't always rely on our first responders. I mean, if we have an extreme storm or hurricane rolling through and trees are down, our neighbors then become our first responders. So we're very mindful that intentional community connectedness is a really key component to resilience. And then making sure that people know their neighbors, that they develop these kinds of friendships. COVID has had a really huge impact, especially on our aging community, because people have had to stay home and they've been isolated. And that isolation is one of the most detrimental aspects of the pandemic in terms of mental health, because we know that connectedness, friendships, having conversations, that those are the small things that have big impact with mental health. So we're looking very closely at how we as a committee can help bolster that resilience in a proactive stance, but also in a reactive stance, realizing how COVID has really impacted our community. I wanted also just very quickly to say, to piggyback on Laura Mitchell's comment earlier, that words matter. When I first joined the committee a year and a half ago, I was labeled as a consumer. I'm a survivor of attempted murder. And so I did have PTSD and had counseling for many years. But I think it's really important that we understand that not everyone's going to find healing in a clinical setting. And so even using the word treatment means that you're treating that individual rather than respecting their lived experience. So right now, I went because I complained about being labeled as a consumer. I don't think labels serve any good purpose other than insurance reimbursement. But we changed from consumer to individuals who are currently receiving or have in the past received mental health services. You can imagine what that looks like on a name card. So I would encourage the county council to both look at individuals with mental health or who have had mental health concerns and individuals who have struggled with substance use, to think about using the terminology people with lived experience. I think it honors that this is it's not a weakness. It's part of the human experience. It's part of what we live through. And then lastly, I just wanted to say on outreach and making sure that people know about services. There are a number of pathways that I think we could utilize more effectively, like Nextdoor, using and partnering with faith communities, and even our emergency response system. And this is something, as we think about climate change and severe weather events, we're not restricted, or the Department of Emergency Preparedness is not restricted in those alerts in adding more detail. So if we know a community is at much higher risk for flooding, we should specify, if you live in this area, like evacuate. And we can also say, if you're struggling in the aftermath of the storm, here are some services that you can take advantage of. We need to think about not just alerting when there's danger, but including these important supports that are there for people that might be struggling in the aftermath.
Ms. West, I'm sort of speechless. I can't thank you enough for both sharing that, but also your comments. It's so powerful. It's hard to put into words. So thank you for that. It's incredible. And just sort of underscores, we had a session a couple of weeks ago regarding mental health bed capacity, because what we're experiencing now in emergency rooms is emergency rooms are during Monday through Friday, more in what's called code blue than not. What code blue means is that all emergency room beds are utilized. And so when a 911 call comes in, they will continue to see crisis cases, but cases that don't rise to that level, the ambulances literally have to wait in the parking lot until a bed is freed up before the patients can be seen. And it's multiple issues. One is they're having staffing concerns in emergency rooms across the board. Volume is up, but it's also mental health bed capacity, because there aren't referrals for these individuals to be able to go to. And so in some cases, there was one instance in which one of the hospitals testified there was an individual that had been there for 2 weeks. So it's a huge issue and is having a cascading effect on our entire public health system. And we've had numerous sessions on this in a variety of different ways, but we're going to continue to push for this because it is so critically important. So thank you for that, both testimony and your leadership in that space. Ms. Sponsor, I've had the opportunity, so I've shared this publicly before. My wife has gotten very engaged as a volunteer with the Family Justice Center. And so we as a family have become much more familiar with these issues and that are so critically important in terms of being able to provide support. And the issue for case management is a very significant one, and the ability for an individual to navigate a complex system so that somebody doesn't have to be re-traumatized when they have to explain their story to multiple offices, to multiple people. We have to be able to provide that level of support in a way that's human, in a way that also leads to better care for these individuals who have obviously been in crisis. And I do think, the issue of victim assistance is so important for so many different reasons. We're in and crime is up, unfortunately. And so, there is undeniably a lot more need that's out there, which sort of underscores the urgency. And this council has been working hard on trying to be a bridge between transparency in law enforcement and dealing with generations of inequity in our criminal justice system, but also on a parallel track acknowledge the support and needs of our victims in so many different ways. So it's a complex issue, but one that I continue to be very impressed with the board's work, and just want to thank you very much for your leadership. And we will come back to this issue of case management. The number, unfortunately, of 2% receiving housing is an awful number. I mean, just depressingly low. And clearly that is another link here that we're going to have to connect to if we're going to be able to not just triage needs, but holistically address them, for years, which I think will be important. And then, yes, go ahead, Ms. Ponce.
I was just going to say thank you to your wife as well, and thank you for that input on the 2%. I was looking at the numbers from Betty and Cranky, and it really, the need is more like 15% of those. They serve about 200 individuals annually, and they need more like 15% of those individuals once they've gone through the 60 days that they can stay at the shelter. About 50% and their families do need some sort of other housing. If the number is somewhere between 8 and 12 that Betty and Cranky gave us, but then you also have to consider that 5% of the victims return to their abuser. So I'm including that in the percentage that really should have better housing, and even if they end up going back to the abuser eventually, that they have that transition year to be able to be prepared for and rehabbed and whatever that means for both the abuser and the individual.
Thank you for that, Ms. Sponsor. That's a very important point. I appreciate that. And then my closing comment, and then Councilmember Glass has some comments that he'd like to make as well. To our Montgomery Cares Advisory Board team, thank you so much. We have been able to weather the storm much more effectively than a lot of other jurisdictions during the pandemic, in part because of the infrastructure we have in place that you all help us connect the dots for so beautifully and so importantly. I do want to underscore two things, and we've heard it for years now, but the need for more concentrated dental services in communities. Now that's again a supply and demand issue. We don't have enough dental health professionals, but we know that this is a long-term issue and a really deeply systemic one. And Councilmember Rice has been a real leader in this space as well. And we're going to have to continue to push the envelope, whether it's through mobile medical opportunities or other ways to reach communities, because it's indicative of so many other public health issues. And so it's a really important component that we want to stress and highlight. And then finally, I like the setting up of the value-based approach. That makes a lot of sense to me. And that's another opportunity for us to be able to follow up on, because we have to, from just a dignity standpoint, we got to make it easier for folks and for them not to feel in any way that there's a stigma if they access these services that they don't just need but deserve. And it's in everyone's interest for us to be able to provide them. And I think it's also critically important across the board, but in particular here, that the cultural competency of the individuals who are in the best position to articulate what those services are has also never been more important. And so that's another opportunity. These health promotores that I mentioned earlier, great opportunity for us to educate them, as they have been, on what services residents have available to them. That's the kind of bridge that we're going to need to have more of moving forward. So thank you very much for your testimony, Mr. Swan. With that, Councilmember Glass, you get the last word.
Well, I'll be quick. I think it is, I'm trying to find the right word, right? Because there's been a lot in this conversation, and I appreciate Helga, you opening up and sharing your truth with us in this public forum, and about how important these services are, and the work that you and members of your board are doing. But when you take a step back, this last panel, I think, is so incredibly impactful, and the similarities between the work and the need are obvious, because over the last 19 months, let me say it again, we've known that these services are important and that they have been growing here in the county and, quite frankly, across the country. But they've been exacerbated by the last 19 months when people have been stuck at home and they've been isolated and they've been with their perpetrator, whether it is mental health needs that have not been met, or other traumatic interactions. That is what this conversation is about, and how we create safe spaces and help people get back on their feet and get them to safety. The interrelation between all of this is just obvious, and bringing it all together here at the last panel for today is just really important. And so I just want to thank all of you for elevating this, because we've got to do better. We've got to provide these services. And with Montgomery Cares, bringing them into the conversation as well, they are the ties that really bind our social safety net for our most unfortunate here in Montgomery County. And so thank you I'm somewhat at a loss to talk about this in a way that has not been said by you all, and you all are way better at expressing the need for these services and sharing with us who these people in our community are, because they are us, they are you, quite frankly. And so let's continue this so that as we reemerge from this pandemic and this post-COVID community that we are going to rebuild, we have to put greater emphasis on the needs that we know we need to take care of. And as people emerge from their homes and start speaking up and speaking out and demanding the services or are seeking these services, we need to provide for them. And so please do continue sharing with us what you are hearing and seeing so that we can put these stories and the needs of our residents into the budget and into other programs to make our community better moving forward. Because if we're going to learn anything from the pandemic, we know we need these services now more than ever. So thank you for your work and your efforts to lift up and make sure that everybody feels safe and protected in our community. With that, I yield back, Mr. Chair.
Thank you. Well said, Councilmember Glass. This has been extremely powerful and enlightening testimony from all of you. Thank you so much. Lots to follow up on. And we will be reconvening again on Wednesday morning, once again at 8:30, to make sure we have time for all presentations, where we will be hearing from 10 more of our boards and commissions. But thank you all so much for taking the time to be with us today, and we look forward to working and partnering together again in the future. Have a wonderful day, everyone. We are adjourned.
Thank you all.
Thank you.